Well, hello again. Dr. Childress back in the Facebook world. This time I want to talk about forensic psychology for a little bit because we're right in a moment in time where it's pretty evident their role in this whole uh, enactment, trauma reenactment narrative situation. And their role, the for forensic psychologists, is basically the Republicans, the Trumpian Republicans, who abdicated their responsibilities and just became allies of the pathology. And for forensic psychology, it's they've abdicated their responsibilities for diagnosis, for treatment, and to protect. Their failure in the duty to protect. They were failing to protect the child from child psychological abuse, and they're failing in their duty to protect the targeted parent from intimate partner violence, IPV, spousal abuse using the child as a weapon. And the reason they're failing in their duty to protect obligations and ethical obligations and professional to solve things for these families is because they are failing to know and apply the necessary knowledge. And there's reasons for that. Um, this is a very dangerous pathology for mental health people because it's the pathology of one of the spouses, the narcissistic or borderline, is very retaliatory. It's psychotic, they're delusional, they're persecutory, so they believe everybody's out to get them. So if you try to interfere as a clinical psychologist with what they're doing, they're going to come after you. They make allegations that you're abusive to them and that you've done this or that. And their wild allegations are not true, but we have to defend against them. And so they'll file licensing board complaints and stuff against us if we try to interfere with what they're doing. In addition, the forensic psychologists don't want us over here. And so if clinical psychologists come over, the forensic psychologists will work with the pathological parent to get us to go away. So they have defined this as their turf and they own the families here. No other psychologist can come work with them except for forensic psychologists, or if the clinical psychologist, they have to maintain a very tight, constrained role, such as the child therapist. But they give their family therapist to themselves, which is, they call it reunification therapy. There's no such thing. There's no book ever written. They just make stuff up. They make everything up over here. But they call it reunification therapy. And what they do is a child custody evaluator in one case becomes the reunification therapist in another case. So they basically pass you guys around between custody evaluation or reunification therapy. There's no such thing. So it's all an inside industry. And the reason is clinical psychologists don't want to work with you. You're too dangerous. Narcissistic borderline pathology is intractable. It doesn't change. So there's very little optimism about creating any sort of solution for the family. So there's no gratification or reward from being successful. It's just going to be just our license is going to be at risk from the pathology of a crazy narcissistic parent in delusional collapse. The forensic psychologists are going to be out after us if we make any sort of deviation. There's an attorney who's, from the pathology of the parent who wants to discredit us, and so they're going to try to go after us and get us off the case to discredit it. So they're got flying monkeys. Holy cow, there's all sorts of flying monkeys who will descend and attack as well. So clinical psychologists don't want to work with you. So we don't. What we say is, I don't work with high conflict divorce. We decline. Now, we can't decline unless we offer referrals. So we say, you need to. So we've created this field, forensic psychology, to give us you to, not us. Go be with them. And then the moment we do that, we don't care about you anymore. And so you've been abandoned by clinical psychology. All the treatment people don't work over here. All the people with knowledge about pathology don't work over here because it's too dangerous. So who comes to work in forensic psychology? Why would you come over here if there's no gratification from actually solving anything? And if it's so dangerous, why would you come over here? Easy money. You get court ordered stuff, so it's easy money, and the child custody evaluation, $20,000 to $40,000 or 6 to 9 months. Those are easy peasy to do, and there's no knowledge applied. You don't have to know anything over here. You can just start working and just make stuff up, and everybody accepts that, and it's okay. And so they make huge amounts of money from their custody value. So they're essentially over here financially exploiting the vulnerability of these parents. And that's like a really bad problem. The issue, though, is if the parents file licensing board complaints against the unethical practices, failure to know the knowledge, failure to apply the knowledge, inadequate assessments, all this sort of stuff, failure to duly protect. They file a licensing board complaint. You know what? The licensing board complaint has forensic psychologists on there, and they give it to one of their forensic psychologists because that's their field. Clinical psychologists don't work forensic. We don't know what's going on over there. So they don't give it to one of their clinical people. They give it to one of their forensic psychologists because that's their field. And they're like, okay, so here's the role. They are the Republican Party. We impeached Trump. They didn't remove him from office. So then he just keeps doing what he's doing. And that's the forensic psychology people. If you don't hold the psychologists accountable for ethical standards, then you get no ethical standards, which is what we have. And when you have the forensic psychologists self-reviewing their ethical violations, they find none ever. And you have no authentic review of the parent's complaint because you put it over to the very people who are unethical and abusing the parent. And they say no, and there's no recourse. So what's going to actually happen off of this is it's actually going to move into malpractice lawsuits, which is over in the court. And then once that happens, oh my God, forensic psychology is going to be held nasty accountable because the courts aren't in collusion with them. And so once the evidence is presented, you're going to start seeing like major malpractice lawsuits against these forensic psychology people. And I would say put it on a class action lawsuit because you're a class of people. You're trapped in the family court system. You've been abandoned by psychology, who's created this field just specifically for you. You're a special psychologist. I compare it to that the camp in the woods, that whole like Auschwitz kind of stuff, is that we put you off in the woods where you're being abused and nobody can hear your screams. And nobody's coming to rescue you, and your abusers, the forensic psychology people, just keep doing it. And if anybody tries to come in, like myself, Dorsey, anybody, we get retaliated against people. And so they're out to get our license or out to harm us and get us to go away. So that's the situation right now, is we got the forensic psychology people who are essentially colluding with the pathology, just like Mitch McConnell and Lindsey Graham and Ted Cruz and everything colluded with Trump's narcissistic delusional stuff for secondary gain. They're doing it for the political power, and they're trying to keep his base. The forensic psychologists are doing it for money. So now let me just point out a little something about the forensic psychology people. Ethical code standards in psychology are mandatory. Now, I know in the legal profession, they're not quite so much. So attorneys have a difficult kind of, I think, sometimes understanding this, but it's mandatory for psychologists, for ethics. And that has to do with the nature of how we work in relationship with people. There's a lot of trust that has to happen in psychotherapy. That doesn't necessarily have to happen in a legal relationship. So that level of trust that's requires that we not take advantage of the vulnerability of our patients. So we have a lot of ethical standards about our patients and their vulnerabilities and what we should and should not be doing. And one of those, a big one, is Standard 2.04, which says we are required to apply the established scientific and professional knowledge of the discipline, which would be family systems therapy, attachment, personality disorders, complex trauma, child development, self-psychology, DSM-5, and ICD-10 diagnostic systems. The established scientific and professional knowledge. We are required to apply that first. Before we go making up new pathologies or adding, first we apply knowledge, the Standard 2.04. Then, to do that, we have to know the knowledge, which is standard 2.01, which says boundaries of competence. We're not allowed to even start working with a pathology until we know what the pathology is and how to diagnose it, how to treat it. Now, these forensic people will openly acknowledge, this is a complex situation and I don't know what we can do about it because it's so complex. Well, if you don't know how to solve it, that's boundaries of competence. Leave, go find out how to solve it, then come back. I can solve it. Dorsey Purdy, she doesn't have a license. She can solve it. If you have a problem solving, go ask Dorsey. Why aren't you asking Dorsey how to solve it? She does it all the time. So if you don't know how to solve it, go ask Dorsey. But just don't sit there and say, I don't know how to solve it. That's boundaries of competence. Go learn and come back. This is not learn as you go. People's lives are dependent, children's lives are dependent upon your knowledge and expertise. If you screw up, their life gets devastated. You may wind up leaving them with a psychologically abusive parent that destroys the rest of their life because of your ignorance and laziness. Okay, no, don't. This is not learn as you go. People's lives are dependent upon your knowledge. Know what you need to know before you get here and apply knowledge first. If that doesn't solve things, if you apply application knowledge, if you can't figure it out, then maybe create some new theory of yours if you want, and we can look at it. But no, I don't want to hear about parental alienation until after you've applied, attachment, family systems therapy, complex trauma, personality disorders, child development, self-psychology, and the DSM-5 and the ICD, the diagnostic system. When you've applied all that knowledge, then if you want to talk to me about some new pathology of parental alienation, we can have a talk. Or resist and refuse dynamics. You forensic people that you're coming up with this new parental alienation? No, Daubert that. Kelly Fry, resist and refuse. There's no such thing. They're just making stuff up again. This is their new version of syndrome. Resist and refuse. Stop it. Stop making up pathology. It's a shared psychotic disorder. It's a ICD-10 F24. You can see it in the social surround right now. Stop making stuff up. Diagnose the pathology. Here's diagnosis. Forensic psychologists openly admit they don't diagnose. For the class action lawsuit, I'd look at their standards for child custody evaluations where they say they encourage forensic psychologists to not use diagnostic labels. Interesting. Diagnostic. What's the difference between a diagnostic label and the diagnosis? Nothing. They're acting like the label is the bad thing. No, the label is the word for the diagnosis. Schizophrenia. That's not a diagnostic label. That's a diagnosis. And so if you're not diagnosing what the problem is this a shared persecutory delusion? Yes or no? Did you diagnose that? I don't know. Well, then how do you know what to do about it? The treatment for cancer is different than the treatment for diabetes. If you don't know what the diagnosis is, how do you know what to do? This could be a shared delusion or it could be real. But you don't know. But then you make recommendations about what to do. How? Diagnosis guides treatment. If you haven't diagnosed, how do you know what to do? How do you know to give insulin or chemotherapy? I don't know. That's not my job. You're licensed psychologist. Of course it's your job to diagnose pathology. That's what the license means. Plus, you have duty to protect obligations. If this is a shared delusion, that's child psychological abuse. You need to do a risk assessment for possible child psychological abuse. Did you do one? No. I'm a custody evaluator. I don't do assessment. Do you think it's relevant for the court to know whether there's a shared delusion, that all these allegations of abuse by that one parent are delusional? Do you think that's important to know? I think so. But did you tell them? No. Why not? Because you didn't even diagnose for it. Failure to use proper care. You didn't even assess for a share. That's failure to use proper care. That's negligence on your part. And every time you fail to diagnose a pathology, that's failure to use proper care. You don't know what's going on. Is there schizophrenia? Is there bipolar disorder? Is there delusional disorder or thought disorder? Is there child abuse? I don't know. I don't use diagnostic labels. The court has a right to the information it needs to make its decision about the case and the matter before it. Withholding diagnostic information from the court is not okay. No, you're putting your fingers on the scales of justice by withholding information from the court. Oh, but it might have a prejudice. That's not your judgment. Whether it has a prejudicial impact or a probative impact is not your call as a psychologist. Let the attorneys argue that with the court. Your job as a psychologist is to assess, diagnose, and treat. And so you assess the diagnosis, you assess the pathology, you diagnose what it is, you tell the court what the diagnosis is for the pathology, and then you tell the court what the treatment is. Diagnosis guides treatment. You tell me the diagnosis, I'll tell you the treatment. Anything, schizophrenia, ADHD, autism, you tell me the diagnosis, I will tell you the treatment. Go ahead. Selective mutism, eating disorder, substance abuse. Pick a diagnosis. Anxiety, generalized anxiety disorder, panic attacks, major depression. You tell me the diagnosis, I will tell you the treatment. On anything. So, court-involved family conflict. What do we do about it? What's the diagnosis? You tell me the diagnosis, I'll tell you exactly what we do about it. So, we can't get a diagnosis. Why not? Forensic psychology people are too ignorant. They don't know DSM. They don't know any of this. They're totally ignorant. They're only over here for the money. So they don't know. And so they can't make the diagnosis. And they don't want to, because the moment they make the diagnosis, they become vulnerable to any sort of legal action. If they say, yes, it's child abuse, then the allied parent's going to attack them and say, how dare you call this a wonderful relationship child abuse? And if they don't diagnose it, the targeted parent's going to say, this is child abuse. Why aren't you? Right now, though, the forensic people are confident that the narcissistic parent will go after them, because they will. That's just a fact. And the forensic psychologists a lot of times working out their own countertransfer and stuff. So they actually believe the delusion, which is a real problem, because then they become part of the child abuse. And so their recommendations are actually abusive of the child. And I read them and I say, oh my God, that's exactly the wrong thing to do. That's going to continue the child's abuse. And that's the recommendation of the forensic psychologist, the child evaluator. So I'm reading this stuff going, yikes, these forensic psychology people are actually participating in the psychological abuse of the child because of their ignorance and incompetence and negligence. So, I'm going to be writing reports when I testify in court. I say that about that. I do checklists of applied knowledge. I look at their information. I say nothing there. I look at the content of what they say, and I say that is inconsistent with the actual knowledge. And that's my opinion on their reports. And they're going to have to deal with the fact that they have not met 2.04 and 2.01. Now, the licensing boards are not going to do anything until we get outside review from somebody other than a forensic psychologist. Example, we submitted a petition, 20,000 parents, to the American Psychological Association. Who'd they give it to? A committee of forensic psychologists. Where to go? Nowhere. And you see their recent proposed guidelines have nothing about the ethical standards or ethical concerns. But that's the APA. So they have essentially colluding with forensic psychology on the cover-up of their unethical practice, because they are not conducting an independent review. And one of the remedies was asked for was a conference of experts, including experts in ethics, in psychometrics of assessment, in cultural psychology, in child development, in attachment, in family systems therapy. Nobody in forensic, and we don't need forensic. We need real knowledge to come together and take a look at this custody evaluation proposal and say, is that anything that's credible or real? No, it's not. It has no inter-rater reliability, which means it cannot possibly be valid. If it takes 6 to 9 months to complete, it's too long, it's out of date. We may have left a child in an abusive relationship for 6 to 9 months while they're conducting their assessment. No, a risk assessment for child abuse needs to be conducted really fast. A clinical or diagnostic assessment can be conducted within 2 to 6 weeks, and we can get a turnaround in a report to the court really fast. If you have a question about the diagnosis, get a second opinion. That's how we deal with it. We don't try and take it to trial. We don't have to get experts arguing about the diagnosis in your court. If you have a problem with the diagnosis, get a second opinion. If you have two problems, get a third opinion. You get three opinions, two opinions, you put them to the court. The court can look at the opinions, see which one most closely matches the evidence and go with that opinion. Or you can get the two psychologists to work together, come up with a joint opinion, whatever it is. But it's diagnosis, it's healthcare. It's not trials, and because this is costing these parents a fortune. Attorneys are so expensive, trials are so expensive. We got to get, and it takes so long. We have the pathology going on for months and months and months with no answers about what to do. We need a treatment plan to fix it. It is always, always in the child's best interest to fix things, to restore bonds of love and affection in the family and stop all the conflict. That's always in the child's best interest, so let's do it. They don't. You know why? They don't know how. It's a breach and repair sequence, Edtronic. Do they know that? No. It's a cross-generational coalition, emotional cutoff, multi-generational trauma. Do they know that? No. It's a narcissistic borderline personality and collapse into persecutory delusions. Do they know that? No. So do they know how to treat it? No. Google negligence. Failure to use proper care. They don't know the knowledge. They don't apply the knowledge. They just make stuff up because they're only here for the money. And it's easy money because there's no requirements to know anything. And no one ever holds you accountable because you're in charge of the hen house. If anybody files a licensing board complaint, it goes to another forensic psychologist and they don't do anything. Okay. Truth is the truth, though. There's a reason for ethical codes. It's because unethical practice hurts people, like all these families and children here. Its ethical standards are mandatory. They are not optional. Standard 2.04, 2.01, 9.01, 3.04 are mandatory. So is our duty to protect. Protect the child from psychological child abuse. Protect the parent from IPV spousal abuse using the child as a weapon. If you fail in your obligations, I don't know what to tell you. I don't know what to tell you. I've given you like lots and lots of time. And standard 2.03. Have you read Foundations? Because Foundations is based on stuff based in 1970s and 80s and 90s. So you're not even in the 21st century yet. So, issue is we got to get clinical psychology back. It is one of my favorite sayings. Don't try to teach a pig to sing. It just frustrates you and annoys the pig. So we can either educate these forensic psychology people who we know from the start are unethical, ignorant, and lazy. We know that from the start because they haven't learned the knowledge. They don't care about the ethics code, and they just don't know anything. So we know that from the start. So now we can try to educate the ignorant, incompetent, and lazy, negligent, or we can go to clinical psychology and recruit back. And that's what my is. I'm going out to clinical psychology, my people, and try to get them to come back. The issue they won't want to, they'll say, I don't work with high conflict divorce. You should see the look I get from other clinical psychologists when I tell them, what do you do? And I say, I work high conflict divorce. And they go, oh, and then they get really, like, oh, because you guys are so dangerous. They won't work over here unless we make it safer for them. And legal system, court system, you need to start considering that. Because, Your Honor, you're not going to get any of the treatment people over here if you're like threatening our license. We'll go work with ADHD where they want us. But you guys fight all the time. And the attorneys fight, and the attorneys want to discredit us. And so they're going to attack us and try to attack. And so it's the licensing board complaints and the legal system need to understand what the pathology is. It's a delusional pathology. And once you understand what we're working with as clinical people, narcissistic, borderline, delusional pathology, you can understand the context of the allegations that are making. In addition, because we will be providing you with the same consistent information, family systems therapy, attachment, complex trauma, diagnostic systems, you will see this information over and over and you will know what it means. So you will be able to evaluate the false allegations being made against the clinical psychologist because you know what we're doing and you know the structure of what we're doing. If you have a problem, get a second opinion. Okay, so that's the approach in. For us psychologists, us clinical psychologists, to stay safe, we have to go in as pairs. That's the second opinion, because this is so dangerous and everybody fights over here that it needs an opinion and a second opinion. That's part of what I'm bringing online with the telehealth consultation. I can serve as a second opinion. But look at this, I'm an old guy. I'm out of here. And so you guys are going to ultimately have to start developing the system of co-assessments, kind of stuff, to make sure that there are reliable and valid assessments of the pathology in the family so that we can come up with an accurate diagnosis that can lead to an effective treatment plan. Okay. The treatment for a shared delusional disorder is twice specified by the American Psychiatric Association. A protective separation from the child will reduce the delusions. That. If the diagnosis is child psychological abuse, which it is, we always protect the child for diagnosis. Physical, sexual, neglect, and psychological abuse. We always protect the child. If that's the diagnosis, protective separation. Diagnosis guides treatment. So is that the diagnosis? Let's find out. And how, Your Honor, how can you make a decision about what's going on until you have a diagnosis whether or not this is child abuse? So let's get a risk assessment for child psychological abuse in all cases of attachment pathology surrounding divorce, where it's like going into the family conflicts and the court system. Normal range families can stay out of the court system mostly. Your Honor, if you're seeing like this family come into the courts, get it assessed, find out if there's child psychological abuse, find out if we got this shared delusion, this Trump cult kind of stuff going on only in the family. We got a parent who's narcissist and collapsing into delusions. Let's get it assessed and diagnosed. The assessment for that is a mental status exam of thought. Mental status exam, thought, and perception. It's frontal lobes, executive function systems. So Google mental status exam. About the third one down, the NCBI entry. It's chapter 207 of clinical methods. Scroll down to the thought and perception section. That's the assessment for delusions, thought disorders. You can read it right there. Paragraph 3, it says it's the mental status exam of thought and perception is one of the most difficult to do and requires considerable experience and often involves consultation with somebody who's more experienced because of that. Now, all of that is true. It is hard. It does require a good deal of experience and training, and it does oftentimes involve consultation because it is a specialized, difficult version of the mental status exam. Now, I have that considerable experience. I worked for 12 years on an NIMH research study, longitudinal research study at UCLA, Keith Nectarline, on schizophrenia. This is one of the major studies on schizophrenia, and I'm big in NIMH study. I would say it's probably top 5 nation, but I would say it's number 1. Keith, I think, would be number 1 schizophrenia expert. But every year we were trained to research reliability and clinical reliability in the assessment of delusional pathology, schizophrenia, hallucinations, all the symptoms, but delusional pathology, thought disorders, the mental status exam of thought and perception. So every year for 12 years, I received annual training where we had to watch these videotapes that the diagnostic unit would film during the year, and we had to rate them and get like 90% agreement with the diagnosis of the director of the diagnostic unit for those tapes. And if we didn't, we had to watch more tapes and make more. And I was like, oh my God. So and then we'd go through lecture series. So every year for 12 years, I was trained on the mental status exam of thought and perception. I know how to do that. And so court has actually ordered me in a couple of cases to come up and do an assessment for parental alienation. And so I met with the allied parent and the child, and I did a mental status exam and thought and perception with the mom and pulled out the delusion there. Yeah, there it is. I met with the child, nice gentle interview, but I got, yeah, okay, we got a shared delusion. Child believes the same thing. And that it was like easy peasy. The there was a court reporter present. The opposing party said, we want a court reporter. So great. I loved having a court reporter present. I want a transcript of all my clinical interviews for court-involved psychology, please, because it's so easy. I can just go down the transcript, show where the delusion is, because we actually take it out in the session and look at it. So I can show you the features, I can show you everything about it on the transcript, and the judge can look at it. And then the other side wants to argue that's not there, they can argue that, but the judge can decide whether or not it's there. And so having that transcript is really nice. I like that. And psychologists, we perform all the time. We behind one-way mirrors, and I'll be out there in the center, and I got like students watching me do my therapy. So yeah, we do that all the time. We videotape our therapies, bring them into supervision and stuff. So being observed and doing the diagnosis, I'm fine with that. Or telehealth. You put another psychologist in my assessment session, and they can watch me doing it, and then we can talk afterwards or stuff, or put me in their assessment session. That consultation. Standard 3.09 of the APA Ethics Code talks about the importance of professional to professional consultation. We encourage it because it improves the quality of the care we provide. It improves the quality of our diagnoses, and so we encourage that professional consultation. It also improves the education and training of all the people involved. Ultimately, I hope to kind of do something like that where I'll get some like 6-month consultation groups where people can sign up for like a 6-month series, and we can kind of do consultation once a month about the cases that they have during that period. So I'll put that together at some point when I have time. So forensic psychology. On this piece on forensic psychology, they actually need to go away. There's no reason for a field of forensic psychology. The referral question, what should the child's custody be, is not an appropriate referral question. We don't know. There's no information in all of psychology that will allow us to answer what should the child's custody schedule be. What's in the child's best interest? To fix the family pathology. Well, other than that, I don't know. There is no best interest other than fixing the family pathology. That requires a treatment plan, which requires a diagnosis. So let's get an assessment, get diagnosis. Then I'll tell you what the treatment plan is. You tell me the diagnosis, I'll tell you the treatment plan. So you're out for it. I just need to know what the diagnosis is first. So that referral question for custody is not appropriate. Clinical psychologists should not take it. The referral question for us is, which parent is causing the child's attachment pathology, and what are the treatment implications? I can answer that. Which parent's causing the pathology, and what do we do about it? And I can probably get your report back, or a clinical psychologist should be able to get your report back within 6 weeks. That's the outside limit for clinical psychology, 6 weeks. I'd prefer it in 2. I'll take it in 6, because after 6 weeks, the timeliness of it ceases to lose its relevance. We have to do it again. If I get results back at 3 months, that's too late. What's it now? 3 months from now, what is it like? Because I need a treatment plan for what it's like now, not what it was like then. So I need like a quick turnaround on the assessment to guide my treatment plan. So forensic psychology, they're ignorant, they're lazy, they're unethical, they're negligent. And the laziness is the big one, because they're not moving. They don't care. There's apathy. They don't care to apply knowledge. They don't care to be good. They're protecting their turf, and they're ignorant. And so they just want to get me gone kind of stuff, rather than integrating what I'm saying and saying, hey, maybe we should look at this. And so that's going to set up a situation where the licensing boards aren't doing anything, so they're not protecting parents. So the parents have no recourse in that way. Only recourse they have is in the lawsuits, and then it's going to be my recommendation is a class action lawsuit, because you want to hold the AFCC and APA accountable for their collusion. The APA and AFCC should be getting on their membership, their psychologists for standard 2.04, 2.01, 9.01, 3.04. Look at their recent flyer for their upcoming AFCC convention. They talk about parental alienation. They talk about estrangement. They talk about refuse and resist. But they got all these bubbles and stuff, and a lot of them are just blank, and they make no sense. They're just so totally confused and inept. They don't talk about attachment or cognitive dissonance or complex trauma, child psychological abuse, or delusional disorder, shared delusion, cross-generational. They don't talk about any of that. But they're still talking about like refuse and resist, making up stuff. It is clear they are not, or it's clear they are in violation of standard 2.04. Just clear. Just from the front cover of the convention that they're doing. And if you can't put that on a class action lawsuit for them, holy cow, their AFCC is in violation of standard 2.04. Why? Because they're also in standard of 2.01. They don't know the knowledge. And because of that, their assessments, 9.01, are not based on information sufficient to substantiate their findings. And notice a reference in 9.01 to 2.04. I mean, they're massively in violation. The AFCC is. Now, the AAPA, all psychologists, including those in the AFCC, but all psychologists have ethical obligations under standard 1.04 and 1.05. If we learn about unethical practice in another psychologist, we have to do something. That's required. The ethics code is required. It's mandatory. It's not optional. So standard 1.04 and 1.05 are required of every single psychologist, or else that's unethical practice. To allow other psychologists to do unethical things and not do anything about it is unethical. So standard, that is so important that the APA put 2 full standards about it. 1.04 says don't go right to the top, see if you can handle it informally, but standard 1.05 says if it's not handled that way, you got to keep going. You got to do something about it. You cannot allow other psychologists to just practice unethically. And that's standard 1.05. So I've done that. I've posted videos. I've petitioned to the APA. I've notified them. I'm writing letters to the individual psychologists on 1.04. Because it's required. What about the APA? 20,000 parents submitted a petition to the APA alleging ethical violations, which are true. Those ethical violations being alleged are true. The psychologists and the APA knows it. What are their obligations of the APA under standard 1.05 for the APA? They are in violation, I would contend, of their own ethics code standard 1.05 for failure to take action against the unethical practices in forensic psychology. They are colluding with the cover-up of unethical and exploitative practices within forensic psychology, and so is the AFCC. So if you can't put that on a class action lawsuit that the human rights of parents are being denied in the family courts because of the ignorant, negligent, incompetence of the forensic psychologists who refuse to diagnose pathology, okay. So it's not my license on the line. So forensic psychology, you can do what you do. Principle D. Before I end with forensic, let me just talk about Principle D. So what I'm talking about is standards. So those are more specific. This is a basic principle of ethical practice. Principle D, justice. And what Principle D guarantees is equal access to psychological services. Now, we don't have that. We have some families who have money getting these complex, big, huge forensic evaluations with MMPIs and Rorschachs and stuff. And we got folks who can't afford that getting like nothing. Now, why do if we need that, we should get that to everybody. But if we don't need that, then let's get something up. Why are we giving that if we don't need it? Why are we getting a big $40,000 if we don't? But if we need that, then these other people need that too. But we are restricting their access to it because they can't afford it. And so we have to come up with something that's affordable for families that meets the need for all families. That's justice. We can't just say we're going to treat the wealthy and give them really good quality service and the poor we're not. That's what forensic is doing. No, that's not okay. That's not justice. We need to ensure that all people have the same quality of clinical services, of professional services. And so that's our obligation, our ethical obligation under Principle D, equal access to psychological service. So child custody evaluations are just off the top in violation of a very principle of ethical practice on justice. But in addition, Principle D requires equal quality in the psychological services provided. And that's not true because two different custody evaluators can reach two different conclusions based on evidence. There is no inter-rater reliability to the assessment. And without inter-rater reliability, there can be no validity. Without reliability, there's no validity. That's just axiomatic in assessment. And so we know for a fact these custody evaluations are not a valid assessment of anything because they're not reliable. Two different evaluators can reach two different conclusions and recommendations based on exactly the same information. They are not reliable and they are not equal quality. And so some are like good and some are awful, and they will admit that. In their writings, they say there's a high variability in the quality of our custody reports. And you see that all over the place when they talk about it. That's a violation of Principle D. And so you'll see with the clinical evaluation that I came up with, or structured up with, I am abiding by that. It is 2 to 6 weeks, probably within about $2,500 range. And you return a diagnosis on that. And it meets the standards. It applies the knowledge. We're looking at the diagnostic systems. And so it's equal access to everybody to an affordable assessment of equal quality because it's structured and sort of standardized in its approach looking for a particular diagnosis that guides the treatment situation, a very specific referral question. So a clinical assessment will meet Principle D. A forensic psychology assessment, custody assessment, is in violation of Principle D, ethics, justice, of the APA. So forensic psychology, though, doesn't, and no one's holding them accountable because they own the turf. They own the licensing boards and they own the APA. So you say, APA, please help. And they say, go talk to the forensic psychologist. You go, licensing board, please help. And you say, go talk to the forensic psychologist. We need outside review, please. We need ethics, somebody from ethics, not from forensic psychology, nobody representing forensic psychology. We need ethics. We need cultural psychology, big time. They need to get over here because there's massive cultural problems with these custody evaluations. Holy Toledo, massive. So for cultural psychology, it needs to get over here. Ethics need to get over. Psychometrics need to get over here. Oh, this is just awful what they're doing. So those three biggies, child development and attachment. Oh my God, what's happening over here? These recommendations, they will code when they see these recommendations. Family systems needs to get over here and evaluate what's going on because they will provide a solution. Holy cow, they'll say, why are you doing this? Why not do this? Absolutely right. Let's apply family systems therapy and all of a sudden we can start fixing things. But if you don't apply knowledge, everything's a mess. So, so we need outside forensic psychology, and until we get it, psychologists refuse to diagnose child abuse when it is warranted. Children will be abused. That is a fact. And so, psychologists, my colleagues, you need to start standing up and diagnosing child abuse when it is warranted so we can protect these children and protect their parents from IPV spousal abuse. If you don't, that's a failure in your duty to protect because you did not perform a proper assessment of child psychological abuse. A mental status exam of thought and perception to see if there's a shared delusional disorder. So with that, let me wrap up my little tirade about forensic psychology.